Training for marathons is a labor of love. It is time intensive and physically demanding. People who are training for something as intense as a marathon assume they will have pain. In fact, runners tend to accept any aches or pains just as part of the process. That is until they just can't handle the pain any longer. When the pain is no longer just happening during their runs, but it is stopping them from running, or the pain is still there while they're walking, sitting, or standing during their normal daily life. If you're training for a marathon and you've been dealing with pain that started off as more of an annoyance, but has now proceeded to interrupt not only your marathon training, but also your everyday life, at this point, you've already tried ice, biofreeze, foam rolling, and every exercise or stretch you could find, and you aren't sure what to try next. This video is perfect for you. I'm Dr. Molly with Your Goals Physical Therapy, and I help runners end their aches and pains so that they can get back to running at the level they want without medication, injections, or surgery. I'm going to go over 3 things to look for that will let you know when it's time to see a running specialist for your pain. Then I will talk about what it would mean to work with a running specialist. Let's get started. When should you see a running specialist for your pain? Number 1, when the pain lasts longer than 1 to 2 weeks. Training for marathons is going to be uncomfortable, and there will be longer runs and more intense runs that will cause muscle soreness. That is just a fact of training. However, that soreness should not last longer than 1 to 2 days. No exercise-induced soreness should last longer than 1 to 2 days. When you have soreness that lasts longer than a day or 2, that means your body has not recovered from that run. You can certainly have repetitive muscle soreness. For instance, if you run 3 times a week, you will more than likely be sore 3 days a week. What you're looking and hoping for is that as you progress through your running training, that intensity of muscle soreness and the duration of your muscle soreness will go down over time and not up. If, as you progress through your running program, your muscle soreness is progressively increasing, that is a sign that your body is not fully recovering between your runs. And trying to take a day off of training and stretching might be a good idea. Try foam rolling, ice, anything you can think of to help your body recover. So number 2, when the intensity goes up while you're running. I hear all the time, I'm fine for the first few miles, but then the pain starts and it progressively gets worse as I run. As you run, you get tired. This is normal. But if you're having pain, then your body is telling you something is not working properly. And I know pain is uncomfortable and scary. However, pain is still a gift from your body. It is the way your body communicates with you that something is not right. It does not mean that you have to stop running or give it up. However, if while you're running you develop pain slowly over time or at a specific distance or with a specific speed and an aspect of your running form is breaking down, causing one part of your body to work harder than others, which will result in overuse, fatigue, and then pain. So number 3, the pain sticks around after you run. Muscle burning while you run is normal. Therefore, it's easy to ignore. Running is hard. Having muscle soreness after a run that resolves within 1 to 2 days is normal. However, if that muscle soreness or joint pain does not go away after your run and it starts to bother you while walking around or your normal activities, this is not normal. Pain that doesn't go away after you stop running and then progressively starts to interfere with simple walking around in your home or at work, sitting at work or in your car, standing in a line, This is not normal. It is time to find out what is happening. Running should be enjoyable. While it can be challenging, that's part of what makes it fun and fulfilling. Nobody wants to associate pain with fun, and running should definitely not be painful. Again, I keep repeating this, but muscle aches go away after 1 or 2 days. With some rest, some ice, stretching, that is normal for running. However, if you're experiencing muscle or joint pain that has a sharpness to it, it lasts for weeks or even months and gets worse over time to the point where it's disrupting your daily life and you're concerned you may have to stop running altogether, it is time to see a running specialist. Our mission is to ensure that everyone can continue running for as long as they desire. Our approach begins with the mindset of addressing what's necessary to help you return to pain-free running. When you start with this perspective, all you need to do is discover the steps that it will take to lead you to your goal of getting back to running. So here are 2 ways that you can get started with me. First, we have a running assessment. A running screening or assessment is a 30-minute movement assessment that gives you an initial high-level overview of the underlying factors that contribute to your discomfort. It's a preliminary screening, so it's less specific than an evaluation, and there is no treatment. Instead, think of it as a guided exploration. During the session, I will observe your movements and assess your running mechanics and gather general information about your condition. With this process, it will reveal any apparent red flags that lets us determine if further investigation is needed. The running screening is an excellent starting point to understanding your situation and next steps before committing yourself to a full evaluation. Now, another way to get started is an evaluation. This is a 60-minute session where we will discuss your running concerns and go through a thorough, detailed physical exam. We will find the root cause of your pain while running, then create a personalized treatment plan that will get you back to running at the level you want. Well, I hope that this information is helpful. And until we have time to talk, I hope